Let's talk about weaning in infants. So in this short video, I'll be discussing about when to start weaning, that is starting solids for a baby who is only on breast milk, and how to start the weaning and what not to do when you are starting weaning for your little baby. First of all, when can you start weaning for your infant? According to the World Health Organization, it is recommended to give only breast milk for a baby during the first 6 months of life. However, there are some exceptions. The first exception would be a baby who is having little difficulties in gaining weight adequately despite receiving optimum amounts of breast milk. For in these babies, we generally recommend to start weaning or start solids around 5 months of age. The other category of babies would be those babies of mothers who need to go to work at 5 months of age. So rather than introducing formula or baby milk powder, it's a good idea, or it's a better idea to start weaning in this category of infants also. However, before starting weaning, there are a couple of questions that we need to answer. The first one, actually, these are to make sure that the baby is ready to receive solids. The first thing is baby should be able to keep the head straight. If the head is very wobbly, then maybe it's not a good idea to start solids because the baby might not be able to tolerate it. And the other thing is the behavioral response. Whether the baby gets excited when he or she looks at food, when the other family members are taking meals, whether you see the specific interest in the baby. So a baby who can maintain a nice erect posture with a good head control, with some interest in solids, yes, we can recommend maybe around 5 months of age to start solids. But if it can be allowed, if it is feasible, there's no problem at all in continuing just exclusive breastfeeding until 6 months of age. Next question: how to start weaning? Right. So here it's very important for you to identify a specific area of your house and get a good chair, a feeding chair for the baby, and then do it in a way not distracting the baby, but you interact with the baby in such a way that you talk to the baby about the food, about the texture, about the taste of it, and you show love. You should never do forceful feeding. It should always be responsive because we respond to the hunger cues of the baby. So we have to always wait until the child feels the hunger. For this, it's important that the child is not being fed in the previous 3 hours. Now you begin the solids with smashed rice. You should never start kanji or liquid type of food or any juices during the first year, because you see when the liquid content is high, the energy density of that food is quite low. So that's not going to be helpful. You just feel the satiety only, but the child is not getting adequate energy. So therefore, you straight away from the very first day of giving solids, you start off with smashed semi-solid rice. And to add some to flavor, you add your own breast milk to the smashed rice. And then you introduce with a small spoon, maybe 1 teaspoon, 2 teaspoons on the first day, and go up. Increase the amount according to the response of the baby. You should never do force feeding. And then after 3 days, you're going to introduce something new. So this is a very important concept. That is, we test some new ingredient for whole 3 days to make sure that the child is not getting any allergies for this ingredient. So for example, first 3 days, it's just the rice with milk, your milk. And from day 4, 5, 6, you give maybe rice with dal and milk. And then as the next step, you can introduce another type of vegetable, like maybe carrots. So likewise, after every three days, you're going to introduce something new for the baby. So you can add various types of vegetables and also green leaves. And make sure after about the first 1 or 2 weeks, it's very important to start fish, because it gives you the important component, that is the protein, which is very important for the child's growth. And also it has got a lot of iron in it. So introduce fish very early, usually from the second week of starting the solids, and then from the next week onwards, you can tempt the food with a little bit of oil. Coconut oil is really good, and also um, some coconut milk also can be added. So you can start with maybe half a teaspoon of coconut oil to tempt the food, and then go up in the quantity. So day by day, according to the response of the child, you can go up in the amount of food you're offering. And from the beginning, start giving about 2 to 3 meals per day. And when you have given a good variety, when you have introduced a good variety, and when a child is on a decent amount of food, we generally start with 1 or 2 teaspoons. But by the end of about 7 months, the child should be taking about half a cup, half a teacup, and around 9 months, three quarters of a cup, and by 1 year, a full cup child should be taking. And then we offer about 3 times a day. And when he's on a decent amount of food, what we can do is we give the solids first, and then we can offer a bit of fruit. Again, not fruit juice, but the smashed fruit, and then followed by your milk, and then followed by water, which is boiled and cooled down water. So that's how you proceed. And also make sure, although you start off with well smashed food, it's extremely important that you change the change the size of the food particles month by month, because we have to introduce complexity now. You can't be giving the same amount of smashed food every day, because the child needs to learn how to chew and handle different textures of food. So you need to increase the size of the food particles month by month. Finally, what are the things you should not be doing? First of all, during the first month of life, you should never introduce salt to a child. And also, don't add any sugar. Don't give sweets also, like chocolates, cakes. No, please don't. Second thing is, always go for responsive feeding and never do forceful feeding. That's very harmful. Third thing is distracting the child while taking the food. So that is showing him various types of animals and screens, especially TV, radio, or the smartphones. Those are very harmful things to do. So all the best in starting solids for our baby.